We will be starting the webinar shortly. Hello, my name is Sharon Roberson, President and CEO of YWCA Nashville and Middle Tennessee, and I welcome you to our November Stand Against Injustice Lunch and Learn. We're going to be having a conversation, Tennessee's Tattered Safety Net. Many in Tennessee pride ourselves in being what is called fiscally conservative, but those of us that work very hard to support those who are marginalized in our community know the importance of providing safety nets for those who do not have that support in our community. So thank you for joining us today. Tennessee is one of 10 states in the nation that has not expanded Medicaid. In 2022, Tennessee lawmakers turned down $2.1 billion in federal funds for healthcare, arguing that Medicaid expansion would significantly cost the state in the long run. We are here today to really look at the effects of turning down this level of federal funds on the people that are part of the population of our state. We believe that having affordable and quality healthcare really helps lift up our community. The mission of the YWCA is eliminating racism, empowering women, promoting peace, justice, freedom, and safety for all. We believe that justice demands that we have adequate healthcare resources for all Tennesseans, not just those that can afford it. I want to thank the Nissan Foundation for making these webinars possible and free. This conversation, we hope, will build community, spark dialogue, and build the consciousness of legacies of discrimination and oppression. As always, at the YWCA, we invite individuals to this conversation and not indict them, because we are hopeful that having these types of conversations will have those that are in the positions of power to listen to others in the community and other voices, and possibly understand more about the nuances of the issues such as healthcare. I'm excited to introduce a very distinguished panel of individuals that are experts and leaders in this field. I will ask each panelist to give their own brief introduction. I'll start with Dr. Cynthia Osborne.
Well, good afternoon. I'm Cynthia Osborne. I'm a professor of early childhood education and policy at the Prenatal to 3 Policy Impact Center at Vanderbilt University. And I'm really excited to be part of this important conversation today. My work focuses on state level policies that can have an impact on children and families and their parents. And Medicaid expansion and healthcare is certainly a key policy in that.
All right, Sandra Mooney.
Good afternoon, everybody. My name is Sandra Mooney. Super excited to be here. I serve as a consumer engagement coordinator with the National Healthcare for the Homeless Council, and primarily my work, it services individuals, organizations statewide, bridging the gap between shelter staff and unhoused and homeless families to TennCare supports and resources. So just thrilled to be a part of this conversation and just excited to be here.
All right, Vanessa Zapata.
Hi, everyone. My name is Vanessa. I work at the Tennessee Justice Center. I worked here for a number of years as a staff attorney, but now I'm the Director of Health Policy and Equity. Our organization is a nonprofit legal services organization and advocacy organization, and we primarily focus on safety net programs like TennCare or Medicaid in our state. and SNAP, as well as WIC and other child nutrition programs. And so we're really excited to talk to you all about the work that we do and really have a robust discussion around Medicaid expansion.
All right, and Dr. Tracy Stansberry.
Hi, everyone. Thank you for having me. I am Tracy Stansberry, and I grew up in a rural community and practiced as an oncology nurse practitioner for nearly 20 years, and went back to the University of Tennessee College of Nursing several years ago to work on a PhD with a focus in health policy. And so I completed that last year with my dissertation focusing on the rural hospital closure in Tennessee. And much of my work in health services research has focused on not just hospital closures, but also other rural health equity issues in Tennessee, as well as the impact of the APRN workforce on health outcomes in vulnerable communities. So I really enjoy my work in this realm and greatly appreciate this opportunity to be with you today and share. Thank you.
All right, well, thank you. So we'll start with this. Each of you has described and given a brief introduction. So obviously you have an interest in healthcare in Tennessee as an important issue in your work. I'll start with you, Dr. Osborne, again. How are you currently working on this issue? What's the interface between what you do and this issue?
Well, so at the Prenatal to 3 Policy Impact Center, our whole mission is to be a resource for states to help them to implement the most effective policies that ensure all children thrive from the start. And our approach was to build on the science of the developing child that tells us how important both the prenatal and first 3 years of life are for healthy development, and to identify what the most effective policies are that help to create the conditions in which children can thrive. And we've identified 12 policies that the most rigorous research says, if you do these will have a positive impact. And Medicaid expansion is at the top of our list. Not only is it an important policy because it helps people who will become pregnant, people who are pregnant, people after they have had a child. It reduces infant mortality and maternal mortality. It improves financial stability. It reduces child abuse and neglect. And it is a key mechanism to fund other effective policies and programs. And whether that is home visiting programs or early intervention services or group prenatal care, there's a number of policies and programs that Medicaid is used for, but it's much more common that states that have expanded Medicaid under the Affordable Care Act will take advantage of these additional, of this funding mechanism. The newest area that we're focused on are community-based doulas, and there are a dozen states now that are using Medicaid to support community-based doulas. And so I don't want to take up too much time, but we're really interested in understanding how Medicaid supports both the parents and the children, and it enables for families to have access to more than just health care, but other services as well.
All right. Ms. Mooney, same question. Healthcare in Tennessee. Why is this an important issue in your work?
Absolutely. As I said, with the National Healthcare for the Homeless Council, we facilitate a project. It's called the TennCare Shelter Enrollment Project. And basically, it is to service as that gap to shelter staff, those who are on the ground, doing outreach, servicing those that are unhoused and unsheltered, with the resources, the tools to be able to connect those individuals to TennCare supports. And the reason why that is so important, because just in the day in the life of the work of what I do, it sounds easy enough, to help someone or, to communicate, hey, get connected to TennCare or enroll in TennCare. But on the ground, even, in shelter work, basic needs take priority. Enrolling to TennCare isn't the top priority on an individual's brain or, mind state when you're, without food, without housing. So that's what this project is designed to do, is to create the awareness, to support shelter staff, to provide resources, training, and then to also be supportive on the ground, to go into the community, go into the shelters and actually enroll and support families, and just create that awareness of TennCare and resources, creating that mind state that is not a second nature, but it is equally important to the other basic needs.
All right, Mr. Potter, the same question, but what I would like for you to also do is give this audience an understanding of TennCare and what TennCare expansion means or doesn't mean.
Yeah, of course. So as I mentioned, our organization really focuses on safety net programs like TennCare. TennCare is actually one of the main programs that our organization provides direct services in terms of navigating, because even when you're able to access it, it is really hard to navigate and maintain coverage and get the services that you may need. So Medicaid expansion is essentially an opportunity for states to get accessible healthcare to Tennesseans. So in our state, we're one of 10. We are the minority here who have not expanded Medicaid. So that means when you are looking to receive affordable health insurance and you're looking at TennCare, you actually have to fit in a very specific category as well as meet income requirements to be able to get enrolled. And so that means it's a burdensome for individuals to like figure out, am I eligible for the program? How can I apply? And if the state makes a mistake, how can I defend myself? Because it's not a bright line income requirement for most folks. It has to be, you're also maybe taking care of a minor child or something like that. And there's income requirements that are different for all of these categories. So with Medicaid expansion, this would really reduce administrative burdens. It would really reduce the kind of incomprehensible requirements to be on the program. And it would essentially 300,000 folks in Tennessee would now be able to get health insurance. And that means that they can get health care, which means that they get treated for the things that they need to get treated for. They are doing their annual wellness checkup so that they're able to kind of intervene and prevent any conditions from exacerbating. And this, of course, is going to mean thriving, being able to work, being able to be active in the community. And so we really are very passionate here about Medicaid expansion in our work.
Yes, and the Tennessee Justice Center has been with this for a very long time, advocating for this. And there were times we were closer to getting this becoming a reality, and it hasn't worked, but I keep on, I guess, with the strategy and the fight. All right, Dr. Stansberry, same question. Healthcare in Tennessee, how it's become an issue. And I'm really intrigued by experiences in this rural, urban differences in the experiences.
Okay, well, thank you so much for your question. My interest came obviously as a nurse, and how all of these various programs and then missed opportunities for funding, how that's impacted rural communities. And part of my dissertation work in looking at the rural hospital closures issue was to really ascertain what are the disparities in mortality at the county level in between urban and rural communities. And we clearly saw that there are disparate mortality levels between the two types of communities in Tennessee. And so part of our other approach, and when I say our, I mean my approach along with fellow researchers at UT, was to do a GIS-informed study. So we looked at distances and travel times to hospital and emergency room services across the state. And we also factored in many of the social drivers of health to see how all of this correlated with those disparate mortality rates. And so we did see that at the bivariate level, distance to care clearly correlated with the mortality levels that we were seeing at the county level. But then when we factored in many of the other aspects, the socioeconomic aspects, we saw that some of that distance to care disparity was flattened out a bit, but it really pointed out to me how important the social drivers of health are in these disparate mortalities rates. And so access to care is clearly an issue, but we also know that many of these other components feed into those disparate mortality rates. And so the fact that Medicaid expansion impacts not only how rural hospitals operate, it also impacts those families and the individuals within these rural communities. And so if we don't have expanded Medicaid, we know that that lack of safety net impacts the health outcomes of these individuals. Again, not just from the access to care standpoint, but in terms of how it impacts the socioeconomic status of those individuals and the communities themselves. And so part of the work that I've been doing, I've been volunteering with Tennessee Healthcare Campaign, and they took up this mantle of advocating for Medicaid expansion long ago. And so much of the work that THCC does is advocating at the grassroots level and also at the legislative level for Medicaid expansion. And so we feel like, as others have said, that this is going to impact communities, not just in terms of access to care or the potential to access care in those communities, but also from a socioeconomic standpoint, that it could make a huge impact on individuals and communities.
All right, we'll go back to you, Dr. Osborne. We have seen in our data that most of the states that have rejected Medicaid expansion, which is our version of TennCare expansion, are in the Southeast. What are some of the obstacles to this? Why is there resistance to the, to expanding? We've heard the argument that we're fiscally conservative, but as I said earlier, that puts a real strain on the communities that the government is supposed to be serving. And we do know that we did have a previous governor who did propose to expand Medicaid, so the data was compelling at that time. So what are some of the obstacles to expansion now?
Well, it's a really important question. And I don't necessarily have the best answer, because all of the data, both the data in terms of what it would do for health outcomes, how it would improve the health and well-being in the short term and the long term, save on healthcare costs, the financial solvency that it would give to hospitals, especially rural hospitals, kind of everything, all the evidence points to expanding Medicaid. And there have been some southern states that have done so. North Carolina, just next week, or this weekend, I guess, 2 days from now, families there will be able to begin to access Medicaid, that they finally expanded it. Other conservative states have done that as well. South Dakota had a ballot initiative last November, and they voted overwhelmingly to expand Medicaid. So there's also a lot of popular support, even within every conservative state, to expand this measure. So I think that, and there were new incentives to do this. Had we done this during the public health emergency, rather than the federal government paying, the federal government pays 90% for everyone whose health insurance is included in that Medicaid expansion, who's added to the roll. So they cover 90% of those costs. And they would have covered an additional 5% of the cost of care for everyone who we're currently offering Medicaid services to. And so there was a real big financial incentive to do it. So at the end of the day, there's not a lot of reasons left as to not do it when we know that it helps families, it helps with healthcare costs, and it provides money to the states, rather than it being a political choice that this is something that they don't feel is the right thing for the states. And, you know, we work with all states, red, blue, purple, and I think that this is a political choice more than an evidence-driven decision at this point.
Right. Ms. Mooney, you're working with some of the most vulnerable members of our community. People, for whatever reason, have become unhoused, and as you said before, there are a lot of things on their priority list. However, they are in need very much of quality, accessible health care. Tell me why you think there would be a resistance to providing, let's say, single adults in our state with the basics of health care, health coverage, health care.
I'm trying to find the easiest way to answer that. I go back to the mind state of a lot of the instruction given to, you know, just apply and get connected to these resources is easier said than done when we're working with our vulnerable communities. And I always have to stand on that principle because, like I said, once in the work that I feel like that I'm doing every day to make that statement and to, you know, guide or instruct somebody to get connected or to have accessibility to those resources is not as easy as it sounds. So I'm circling it back to say, with the efforts and the attempts that I feel like the work that we do through this project, it is to really just create that sense of awareness and a realness about what is really going on in the reality of an individual who, like I said, does not have access to technology or a computer or a cell phone, or, you know, to be able to get connected to certain resources that we have at our fingertips. And I hope I'm answering your question. I feel like I'm veering off just a little bit. But I just keep going back to the place of, you know, it sounds so much easier to get connected to these resources when it truly is not as easy as it sounds in most cases.
So really what you're looking at is a broader net to make it easily accessible, understandable, have that safety net for those who are at that crisis stage, who don't have food, don't have shelter, but they have healthcare needs, and to make it easy and more accessible for them, because there are people outside of the urban areas that are unhoused. And I don't know what, at least we do have some public hospitals in the more urban areas. They have no resources.
Right.
So that's a key to make things really easier. And we've seen that in our work at the YW. When we have shelter residents, you need to have not only something or some support that is available, you have to make it accessible and unfortunately convenient for the people who you're serving. You have to make it very convenient in order for them to take advantage of the programs that we do have, the limited resources we do have. Ms. Zapata, the same question. Why do you think that there are obstacles? You all have been, your organization has been at this for a long time, and you've had constant resistance. Why do you think we continue to have resistance?
Well, on the question of Medicaid expansion, I would just echo everything that Dr. Osborne said. I think that, you know, all of the evidence, I mean, a lot of our peer states are like states in terms of political framework is expanding Medicaid. It's saying that health insurance coverage makes sense. And so it does seem that it is a political issue, and it's just a choice that may be rooted in a lot of things that unfortunately is not really based on what the data is showing and what the experiences of Tennesseans are showing.
All right, Dr. Stansberry.
Well, again, I think the politics of it all has certainly impacted that decision. But excuse me, I think that One thing we understand is that most Tennesseans are in favor of Medicaid expansion. But in this state, it's my understanding it can't be a ballot issue. It has to be decided at the legislature. And so until we have that capacity for our electorate to really have a voice in this, excuse me, I'm sorry. Then I think, we're going to continue to see the political forces tug and pull on this issue. And I wish that in Tennessee we had that capacity to put this as a statewide referendum, because I think it would pass at that level. So in my mind, it really goes back to those political forces within the state legislature.
Yeah, I did see in looking at this issue in states where it was placed as a ballot referendum, overwhelmingly it passed, because I think that individuals then are given the opportunities to speak for themselves and speak in terms of, I think this would be a good idea, because, if you look at the broader family issues, you have someone in your family that needs coverage that's having difficulties.
Right.
We had a question in the Q&A and said many of our Tennessee state legislators claim that Medicaid expansion is not the right solution to prevent rural hospital closures. And I remember way back when TennCare was first started and the hospitals were really having the squeeze, because many of these hospitals don't have the large budgets to give to, uninsured care, but yet they're in the rural area and their only option. And so therefore they were telling legislators that without having more resources, even without Medicaid expansion, with just straight up TennCare as it was before, that they would close it. Now that's becoming a reality. I'm going to ask anyone that can respond, how would the panelists respond to that claim? What evidence can advocates use to refute the claim, basically, that the hospital closures has nothing to do with Medicaid expansion? Can anyone give a response to that question?
I will I'll just chime in briefly that the Chartist Center for Rural Health did a study in 2020 that looked at this very question. And in the states that had expanded Medicaid, they had it was still a tight operating margin in the rural hospitals, but it was on the positive side. There was a median operating margin of, I think, 0.8%. But in those states that had not expanded Medicaid, that operating margin, the median operating margin, was in the negative zone at minus 0.3%. So unless these hospitals have other ways of making up for those losses and furnishing that uncompensated care, then over time it becomes an unsustainable operating model. So I would argue that the Chartist Center's work in this realm has supported that Medicaid expansion would make a difference for rural hospitals staying open.
All right. Anyone else want to respond to that question? All right, start with you, Dr.
Necessarily. Sorry, I don't necessarily know any additional evidence to support that, but of the states that surround Tennessee, Mississippi, Alabama, Georgia, and South Carolina will be the only 4 that have not expanded Medicaid in addition to Tennessee. So our other neighbors have, and so we'll be able to see this play out in real time. We know that Mississippi and Alabama have been losing their rural hospitals in really grievous ways, that women are having to travel hours to receive care. And we focus obviously on women who are pregnant or new parents, but that's happening across the board. And so we have a natural experiment that's playing out, and we don't want Tennessee to be in the control group on this one.
All right. And Ms. Zapata, I think that you were going to respond.
Sorry, I was trying to answer on chat in the question and answer, but I don't think I understood correctly how to handle it. But I saw that Frioza Freeland was talking about a new health commissioner who's from Kentucky, who where Kentucky has expanded Medicaid, and how we can use that opportunity to push the issue forward here in Tennessee. And I think that's a great point. We don't want to collaborate just, with voters or the public, or organizations that are specifically interested in this issue. We also want to collaborate with the state agencies, folks who believe that this will improve the livelihood of Tennesseans. And I think just more collaboration, more communication, so that when we maybe talk with our representatives, we can show a united front, show all of the data and how many folks from all walks of life are supporting this.
All right. Okay. All
And
right.
then separately, sorry, if anyone is interested in really actively working on advocacy, you're welcome to reach out to our organization. And I can put my email in the chat if anyone wants to reach out to me, and we can maybe best connect you with projects that we're working on. Thank
you. And we do know that having healthy adults can lead to healthy children, but let's get to that issue. And this statistic, in the back of my mind, I understood, but it was kind of shocking to me that 43% of all children, based on the Kaiser Family Foundation data, are covered by Medicaid, with 51% of children with special health needs covered by Medicaid, which says, you're getting on half the children in the state. And what does research or experience tell us about the role of healthcare and safety net for childhood development? And I think that sometimes, I'll start with you, Ms. Mooney, it may not be viewed as something that relates to what you do, but I do believe that unhealthy children often lead to unhoused adults.
Correct. Do you mind asking that question again, Ms.
Really
Cheryl?
looking at the role of having healthy children and the outcomes as far as having a robust Medicaid or TennCare system.
Okay. Agreed. Like I said, just having the resources and supports to ensure that children are able to get connected to those resources and get the treatments and stay with doctor's appointments, all of that leads to, healthy adults. But again, I just see it from day to day, and in the conversations with shelter workers, not having access to the TennCare supports and knowing how to navigate that system is really reducing those chances for a lot of our unhoused children in Tennessee right now and families. And that's pretty much like the current the current of what I'm hearing from day to day, just having the barriers with navigating, renewing, getting connected, and those children able to be seen right now.
And one thing that we have seen that directly relates to this unhoused population is that this whole access to TennCare that was lost in the renewals, and when you have people that are transient, we saw this with our shelter people who are domestic violence families, people are transient. So you get a letter sent to the last address of record, that is lost totally in the shuffle. Then you lose your benefits and have to start over in what is a very complex system for someone that's trying to hold their lives together on a shoestring. And so that was part of what we saw in what has happened most recently in our regular TennCare system, not even getting to the expansion, what we already have that's happened. Let's go back to that question before we go more on the children in the system. Well, I'll go with you, Dr. Osborne. Let's talk about children who are part of this whole system of Medicaid expansion or present Medicaid resources.
Well, so Medicaid expansion itself does not necessarily affect children's eligibility for Medicaid. At that, it's important to know that the Medicaid expansion extends to adults, but the correlation between adult Medicaid use and child Medicaid enrollment is very high. It's often the case that parents think if they're not eligible for Medicaid, then their children wouldn't be eligible for Medicaid either. And that can also be the case for parents who might not have complete documentation status, but their children were born here. They may not know that their children are eligible and that they should be enrolling their children. So even though we have 43% who are on Medicaid, there's a percentage of our children who are probably eligible who are not receiving it. But healthcare early on for children is so important. Fortunately, most of our little ones are born very healthy, but we have to be screening them, and they have to be coming to their doctor's appointments on a regular basis, especially in the first few years of life, so that we can identify any sort of developmental delay that's happening. Because the research is really clear that if we can identify a delay, a speech delay, an attachment issue, a physical gross motor problem, that we can get access to services for that family, and that child may be able to get back on track for optimal development. But if we're not seeing that little one, if they're not coming to the doctor, if the parents don't have access to health insurance for their child, they're going to avoid seeking care for things that may seem small at the beginning, but can grow into serious conditions. So their child may have asthma, but they're not getting it treated in the way that they would if they had access to health care, but that turns into a much more serious case, or to pneumonia or some other sort of condition. Their child isn't walking by the time that they're 18 months, but they don't know who they can reach out to for that sort of services. So it's so important that we get children access to Medicaid, not just in those earliest years, but across their life course. But when we don't extend it to parents, they often don't understand that their children also need this important, are eligible for and really need this important benefit.
Okay. Ms. Zapata, let's look at this in terms of the experiences of children and their development. Has the Tennessee justice system sort of narrowed down the focus somewhat and looked at the actual Medicaid system, TennCare system as exists in Tennessee, and its effect on children?
Yeah, so I want to echo Dr. Osborne in terms of, if the household is covered, this is helpful for the child and their development as well. And it also kind of allows households to move through the process a little bit better. I mean, it's really difficult, and Sandra mentioned this as well. It's really difficult to maintain coverage on these programs. There's a lot of back and forth. There's a lot of red tape, and we're talking about TennCare here, but a lot of these families, a lot of these individuals are going to be looking at other safety net programs, and each of them has their own set of paperwork, their own requirements. It's a lot to handle, especially if you are unhoused. So Medicaid expansion is one tool to kind of support all of these families. And there are other things too. So, Medicaid expansion is this kind of more, widespread, sweeping change that can happen and really benefit a lot of Tennesseans. But there are also additional tools that our state can look at. So one of the things that we're really interested in, and actually Tennessee for Quality and Early Education, or TQEE, one of their policy priorities is this policy of multi-year continuous eligibility. So this is basically trying to cut through that red tape, that paperwork, that losing coverage for paperwork reasons for these babies 0 to 5 years old. And there are other states that are taking this option. So basically, the state would put in their plan that kids who get on, or babies who get on from 0 to 5 years old, they will stay on through that time period. So while we're looking, and I think we're going to talk a little bit about TennCare unwinding, we're seeing a lot of terminations, and a lot of the reason is because of procedural reasons. So the bulk of the terminations are for those paperwork reasons. So this is really cutting through that for these babies, which, as Dr. Osborne mentioned, this is a critical time for child development, because they are, the more that they go to their screenings, getting their vaccinations, the more likely doctors are able to identify what that child needs and get ahead of any problems that might develop.
All right, well, Dr. Stansberry, let's say the safety net falls apart and the children slip through the safety net. Tell us about the role of healthcare and the safety net programs for childhood development.
Well, clearly echoing what everyone else has already said, we understand that adequate screening and preventive care services and primary care services for children are essential in their proper development and their growth trajectory. But also, to the extent that healthcare expenses weigh heavy on families, we know that that worsens the impact of poverty that may be pre-existing, or it may even take a family who is maybe in a slightly stronger financial position, and just those healthcare expenses can push them into that poverty realm. And again, kind of going back to what I said earlier about the social drivers of health, we know that all of these things play a role in how well someone develops and ultimately their health outcomes. So I would just say that by strengthening that safety net, it not only improves that access to care, but it also improves the socioeconomic status and stability of families.
Mhm. All right, I'm going to go back to this because I want to make sure that this audience understands there is TennCare on Medicaid. TennCare is our waiver that we operate under in Tennessee. That exists. Expansion would expand it to a group of people that aren't eligible under the typical TennCare rules. I want to go back to Ms. Zapata because we have seen in the last 6 months, 100,000 Tennesseans have lost access to their health care. What is this thing we're hearing in the news, TennCare unwinding and unwinding process? You know, for those of us who don't work in this area and don't really follow it closely, what is this thing, TennCare unwinding?
Yeah, of course. I guess first the foundation. We mentioned and Sandra mentioned how there's kind of paperwork involved in being on TennCare and maintaining coverage. And this is actually a requirement. So annually, Medicaid programs, every state's Medicaid program has to check in and make sure that folks are still eligible for the program. And for a lot of folks, that means they have to fill out paperwork that says, this is my financial status, this is who's in my household, so that TennCare can look at its rules and say, hey, yeah, you fit into one of our categories of coverage. And this is the case for every state. Every state has a different Medicaid program, and so there are different rules for them, but this occurs in Tennessee as well. Now, during COVID-19, during the public health emergency, the federal government said, hey, states, we want to pause this. And this, of course, makes sense because we are in a public health emergency. The last thing we want is for folks to be worried to not get treated for whatever they needed to get treated for because they were worried they didn't have health insurance. So there was a pause on this check-in to make sure people are still covered. And there was a requirement to maintain coverage with some exceptions so that people would have their health insurance. And this, in the end of 2022, Congress basically said, all right, we're done with this pause. The end date is going to be March 31st, 2023. After that, states go back to doing your annual check-in and basically every state, we want to plan now because we know that a lot of people have been enrolled on your Medicaid programs, even folks who may not be eligible any longer. So there's a lot more than usually are enrolled in TennCare right now. And so we want you to have a plan to basically get through all of these folks and make sure that they're still eligible. And if they're not, then you would move through the process of course, there's a due process. So this means that you have to go through a bunch of steps to say, hey, we don't think you're eligible. If you disagree with us, you can file an appeal. Then the person has the opportunity to appeal. And that is legally a requirement. So it's not just people are supposed to get kicked off. there's a process that needs to be followed. So Tennessee began its terminations, its reviews in April, and in its plan, it basically said, we're going to start terminating people for procedural reasons in June of 2023. And so this means if people are not responding to that paperwork, or if the state is saying, okay, we got your paperwork, but now we need proof. So that could be like maybe a pay stub or something like that. Then if the household or the individual didn't respond, they can be terminated from the program. Again, they have to get the notice. Again, they have to have the opportunity to appeal. But as Sandra mentioned, you know, some folks are in unstable housing or very transient. And as you mentioned, Sharon, that people can, the system is looking at maybe wrong addresses, and so are sending this paperwork to places that the folks are not living in. And so this means of the terminations that we've been seeing during this process from April, and I think the last report that TennCare published in terms of its data was back in August, was for renewals that from April through August. The bulk of the terminations, like 76%, is for these paperwork reasons. So these folks are not necessarily not eligible for the program. It's just that they couldn't get through that filling out the questionnaire or providing proof that was maybe necessary. And this could be, you know, for a variety of reasons, as we've discussed. And so this does not seem like we're achieving what we want to achieve here. You know, TennCare is health insurance. This is a program so that people can access healthcare, but instead we're seeing just this kind of administrative red tape program that's preventing a lot of people from being able to access healthcare that they need.
Yeah, that's very much what Ms. Mooney was talking about. This is what you're saying. What if they don't receive the documents? Are they just out there, Ms. Mooney?
Yes, ma'am. And what it leads to is hopefully reapplying. But again, it's looking at priority base. If you're unhoused and you need housing or food, insurance coverage is not a top priority until you're in an ER or until your, child has, gotten hurt. That's when it's a priority at that point. So yes, ma'am, that's what it views to be. If the information hasn't been submitted, if an application hasn't been renewed or the paperwork hasn't been turned in, it requires almost like a start over. You have to get connected and reapply in hopes to be seen if you're eligible, which is a major barrier with our unhoused population.
All right, Dr. Osborne, any comments on this unwinding process?
Well, no, I think that both of Ms. Mooney and Ms. Zapata did such a great job of describing that. Although I wanted to just make sure that folks understand Medicaid is a very difficult benefit to understand and why expansion really matters. So just 10 seconds on this, with some exceptions, but in states that have not expanded Medicaid, nearly every childless adult is ineligible for Medicaid. So you do not get Medicaid if you do not have a child. There are some exceptions, but very few. Once you have a child, and once you become pregnant, if your income in Tennessee is 200% of the federal poverty level or less, then you can be eligible for Medicaid. They basically are giving you Medicaid in response to the fact that they're caring for the child that will be born. Once your child is born, then you resort back to what's called parent Medicaid. And Tennessee is one of all but 4 states that have now extended the postpartum period. Used to just be 60 days after you had your baby that you had to go back to parent Medicaid. And now it's 1 year. But once that's over, now you have to go back to parent Medicaid. And now your income has to be no more than 82% of the federal poverty level. So it's not that everyone with low income is eligible. Now it has to be 82% of the federal poverty level. And so you have a lot of these folks who were covered when they were pregnant, and even for maybe now a year after, who do not make enough to buy health insurance on the marketplace. You have to make at least 100% of the federal poverty level to get a subsidy on the marketplace. But they make too much to be covered by TennCare. And that's that coverage gap. And a lot of folks, as we were saying, once you're kicked off, you don't know you can reapply or how to reapply and all those things that happen, that churning that takes place. But there's just not a smooth system. It's not one income eligibility threshold. Once you expand Medicaid, everyone with incomes up to 138% of the federal poverty level is eligible. Once you're pregnant, it's a higher income eligibility threshold, yes, but your income is you're covered, or your income is high enough that you can buy health insurance on the marketplace. So that's why Medicaid expansion helps to get everyone, even childless adults, covered. When you don't expand Medicaid, then that isn't a possibility. You're muted, sorry.
Dr. Stansberry, I see that you're agreeing to me in these comments. Do you have something to add? Because this whole gap situation very well explains how you could end up with coverage because you're pregnant, but then you have a child, and it's very important for the mother and the father to be healthy, but they're just kind of out there.
Right. Well, certainly what Dr. Osborne was saying is what we see in these rural areas. And I think it is very important for people to have access to those who might be willing to help navigate that system. One of the things that Tennessee Healthcare Campaign does is they have a toll-free number that people can call and get assistance with navigating this whole process, because it is complex and it is arduous. And so I will type that in the chat. So if you know of anyone who is struggling either with marketplace purchases or the TennCare applications, then I would recommend calling that number. There are other organizations who have similar toll-free numbers for assistance in this regard. I think Rural Health Association of Tennessee and some other organizations do as well. But I'm familiar with the THCC number, so I'll put that in the chat and encourage people to share that so that folks can take advantage of that resource.
All right, well, thank you. I always love this question when we get closer to the end of our time, and I always like to give my panel of experts the opportunity to speak up and really speak from what they think. If they had a magic wand and they could change things to make things better for those in our community that need resources, what would you change about our system? What would you hope or wish that legislators or even citizens would do to support the effort of providing healthcare for those that are needing our state? I'll start with you, Dr. Stansberry.
Sorry about that. I was trying to type in that number. I'll do that in just a moment. I think many things. Certainly Medicaid expansion is a huge one. I think also recognizing that for us to have a full cadre of healthcare workers in all the different communities that are needed, we need to look at some of these workforce issues and address them. And in terms of Tennessee not being a full practice authority state for advanced practice registered nurses, I think that's also a limiting factor. Something that I've advocated for a long time is granting at the legislative level that full practice authority so that nurse practitioners and other APRNs can practice at the full level of their credentialing and training. And we know from studies that states that have expanded to the full practice authority which, by the way, has been advocated for by the Institutes of Medicine and now the National Academies for a very long time, that those APRNs are far more likely to go into vulnerable communities and to practice there and furnish care there. So that's another thing on my wish list of policy changes is full practice authority for APRNs and other healthcare providers. I also think that we just generally need to take a more holistic picture in Tennessee and look at all of these social drivers of health and address discrepancies there. So when it comes to education and employment and all of these other things that contribute to health outcomes, I just really wish that we had a more holistic approach within our state.
All right, well, thank you. Ms. Zapata, same question. You're looking, you have your wish list and you know you have a magic wand. What would you change and how would you hope that the public supports this change?
I would echo all that was said. And I think the holistic approach is really important and kind of the person-centered and kind of the meaning of what these programs are the goals that these programs are supposed to achieve. I think that there are a lot of misconceptions about what these programs are and who they serve. And I think better understanding of how important it is for these programs to exist, to allow our community members, to allow ourselves to thrive is really, really critical. And I think taking the political conversation away would really help facilitate people really understanding that this is not a political issue. It is not a partisan issue. It is what are the best ways that we can get the resources to the folks who need it so that we all can thrive.
Yes, all right, Ms. Mooney, same question.
Absolutely. I'm taking Vanessa's word when she said person-centered approaches, you know, really looking at it from the people and just kind of really allowing the voices of those who are having barriers with connecting and accessing those resources, their voices be heard to really help streamline some of the barriers to access. That would be a huge wish to come true. Allow those to help shape these processes so we can all thrive.
Yeah, I always say that when we work with the people that are in our domestic violence shelter, I can think of so many ways that they can make the system so much more meaningful in the spirit of why these programs existed or exist, that is. All right, Dr. Osborne.
Well, I really appreciated what each of the other speakers have said and agree so much. And this is my personal opinion, not necessarily driven by evidence. But I feel like if I had a magic wand, that we would have a universal healthcare system. We have it for our elderly population. We have it for our military population. And every other country that we consider our peer has one, and their life expectancy is much higher. Their infant mortality and maternal mortality is much lower. And we spend more on healthcare in this country by margins that are so large relative to any other country as well. And to just contrast Medicaid with Medicare, they're both passed in 1965 in the same act. Medicare was federally administered. It has the eligibility, what's covered, the amount that's covered is all set by the federal government, but it's a compromise for southern states to both implement Medicare. They had to desegregate their hospitals to do so. But in the South, the compromise was that they would get to set eligibility and what's covered and the rates for Medicaid for people with low incomes. And that has, for the last, nearly 60 years, set off a chain of events in which there are some states that are very generous and cover quite a bit and cover most of the folks who need it. And there are other states and who are still resistant to offering the services that are necessary. And because of those disparities, I think that we have to think about a more centralized federal, at least federally administered program, so that we'll have greater equity.
Wow, that's interesting. You brought up something that I did not have knowledge of, really, if you look at it, and it goes along with the mission of the YW, because when you can move toward equity and eliminating racism that's part of the mission of the YW, you can get to the heart of some of these issues that unfortunately are impacting people who don't even realize it, who are not people of color, and that's kind of an intriguing issue, but that maybe that's for another lunch and learn, but that is something that's very important. Well, certainly I really enjoy this really robust conversation. Is very important because having grown up in a military family where we didn't have to think about issues, with 20 years of glorious years of my life, I was just you got sick, you went to the hospital. It wasn't a cost, it wasn't anything, it was free. And leaning on that system that works so well, because that's my experience for those families, it should be like that for our whole society. I truly believe that would make us a better society, a healthier people, make better decisions, make better choices. And it's really much more cost effective. I truly believe that. So thank you so much for this conversation. Of course, anyone is welcome to follow up and support any of these organizations and individuals in their research, because it's important to have our community mobilized to address these issues that we have that are so important. So thank you very much for your time today, and thank you to our audience. Thank you.
Thank you.
Thank you.